Hi, welcome to Professional Certifications channel. Let's break down RHIA exam preparation, one topic a day for focused and effective learning. Today's topic is Medicare Severity Diagnosis-Related Groups, MS-DRGs, in healthcare.
1. What are MS-DRGs? So, what exactly are Medicare Severity Diagnosis-Related Groups, or MS-DRGs? MS-DRGs are a classification system used by the Centers for Medicare and Medicaid Services, CMS, to determine how hospitals are reimbursed for inpatient stays under the Inpatient Prospective Payment System, IPPS. The system groups patients based on their primary diagnosis, secondary diagnoses, procedures performed, age, gender, and discharge status. It takes into account the severity of the patient's condition to calculate the payment the hospital will receive for their care. MS-DRGs are designed to ensure that hospitals are reimbursed fairly based on the complexity of the patient's condition and the resources required to provide treatment. The goal is to incentivize hospitals to provide cost-effective care while maintaining high-quality outcomes.
2. How MS-DRGs work. MS-DRGs categorize inpatient stays into distinct groups that are clinically similar and require comparable levels of hospital resources. Each group is assigned a weight that reflects the relative cost and complexity of treating patients in that group. Let's break down how the MS-DRG system works. 1. Grouping patients based on diagnosis and procedures. The MS-DRG system assigns each patient to a specific group based on the principal diagnosis, which is the primary reason for the patient's hospitalization, as well as any secondary diagnoses or procedures performed during their stay. For example, a patient admitted for heart failure would be placed into an MS-DRG for that condition. 2. Severity levels. One of the key features of MS-DRGs is that they account for the severity of the patient's condition. The system includes 3 levels of severity: without complications or comorbidities, non-CC, with complications or comorbidities, CC, and with major complications or comorbidities, MCC. The higher the severity level, the higher the payment to the hospital, since more complex cases require more resources to treat. 3. MS-DRG weights. Each MS-DRG is assigned a relative weight that reflects the expected resource use for patients in that group. Higher weights are assigned to MS-DRGs that involve more complex cases. The hospital's payment for a patient's stay is determined by multiplying the base payment rate by the MS-DRG's weight. 4. Outlier payments. For cases that are exceptionally costly, CMS provides outlier payments in addition to the standard MS-DRG payment. These outlier payments are designed to cover the cost of unusually expensive cases, ensuring that hospitals are reimbursed fairly even when they treat high-cost patients.
3. Importance of MS-DRGs in healthcare. MS-DRGs are a vital component of hospital reimbursement, but their importance extends beyond just payment calculations. Let's explore why MS-DRGs are so important in the healthcare system. 1. Ensuring fair and accurate reimbursement. The MS-DRG system ensures that hospitals are reimbursed fairly based on the severity and complexity of a patient's condition. By accounting for complications and comorbidities, MS-DRGs reflect the true cost of providing care, reducing the risk of hospitals being underpaid for complex cases. 2. Promoting efficiency and cost control. Since the MS-DRG system pays hospitals a fixed amount based on the patient's diagnosis and severity level, it incentivizes hospitals to manage resources efficiently. Hospitals are motivated to provide high-quality care in a cost-effective manner, reducing unnecessary tests or procedures that don't improve patient outcomes. 3. Supporting quality of care initiatives. MS-DRGs are aligned with quality improvement programs, such as the Hospital Readmissions Reduction Program, HRRP, and the Hospital Acquired Condition Reduction Program, HACRP. By tying reimbursement to both the severity of illness and patient outcomes, MS-DRGs encourage hospitals to focus on delivering effective care that minimizes complications and readmissions. 4. Facilitating comparative analysis. MS-DRGs provide a standardized method for categorizing inpatient stays, making it easier for hospitals, policymakers, and researchers to compare outcomes, costs, and utilization across different institutions and regions. This information is critical for identifying best practices and improving healthcare delivery.
4. Challenges and criticisms of MS-DRGs. While the MS-DRG system is an effective tool for hospital reimbursement, it is not without its challenges and criticisms. Let's explore some of the common concerns associated with MS-DRGs. 1. Potential for underpayment. Some hospitals argue that the fixed payment structure of MS-DRGs may not fully cover the cost of treating complex patients, especially those with multiple chronic conditions. While outlier payments help mitigate this issue, hospitals still face the risk of underpayment for high-cost cases. 2. Incentive to shorten length of stay. Since hospitals are paid a fixed amount per case, there is a potential incentive to discharge patients early to reduce costs. While hospitals must still provide high-quality care, this pressure to reduce length of stay could impact patient outcomes if not managed carefully. 3. Variability in coding practices. The accuracy of MS-DRG assignments depends on the quality of clinical documentation and coding. Variations in coding practices between hospitals can lead to discrepancies in MS-DRG assignments and reimbursement amounts. Ensuring consistent and accurate coding is essential for the system to work effectively. 4. Impact on small or rural hospitals. Smaller or rural hospitals may face challenges in meeting the financial demands of the MS-DRG system, especially if they treat a disproportionately high number of complex or high-cost patients. These hospitals may struggle to remain financially viable under the MS-DRG model.
5. Best practices for managing MS-DRG assignments. To ensure accurate MS-DRG assignments and maximize reimbursement, hospitals must follow best practices in clinical documentation, coding, and revenue cycle management. Let's explore some strategies for effectively managing MS-DRG assignments. 1. Accurate and detailed documentation. Physicians and clinical staff should provide detailed and accurate documentation of the patient's condition, treatments, and any complications or comorbidities. Complete documentation is essential for correctly assigning MS-DRGs and ensuring that the hospital is appropriately reimbursed. 2. Regular coding audits. Conducting regular audits of coding practices can help identify and correct any errors or inconsistencies in MS-DRG assignments. Audits also help ensure that coding is aligned with the latest CMS guidelines and reflects the true complexity of the patient's condition. 3. Clinical Documentation Improvement (CDI) programs. Implementing a CDI program can improve the accuracy of documentation and coding, leading to more accurate MS-DRG assignments. CDI specialists work with clinicians to ensure that all relevant information is captured in the medical record and that coding accurately reflects the patient's condition. 4. Ongoing staff training. Provide ongoing training for physicians, coders, and revenue cycle staff on the MS-DRG system and the importance of accurate documentation. Educating staff on how MS-DRGs impact reimbursement and quality metrics can improve compliance and reduce the risk of errors. 5. Monitoring for outlier payments. Hospitals should regularly monitor their high-cost cases to determine whether they qualify for outlier payments. Tracking these cases ensures that hospitals receive the appropriate additional reimbursement for exceptionally expensive stays.
6. The future of MS-DRGs and value-based care. As healthcare continues to shift toward value-based care, the MS-DRG system is likely to evolve to better align with quality improvement and cost control initiatives. Let's take a look at the future of MS-DRGs in the context of value-based care. 1. Increased focus on outcomes. Future updates to the MS-DRG system may place greater emphasis on patient outcomes and care quality. Hospitals could see more payment adjustments based on performance metrics, such as readmission rates and patient satisfaction, incentivizing them to focus on delivering high-quality care. 2. Integration with population health management. MS-DRGs may play a larger role in population health management efforts, as hospitals use patient data to identify high-risk populations and implement strategies to improve outcomes. MS-DRG data can help track the effectiveness of interventions and drive population health initiatives. 3. Adoption of new technologies. The use of artificial intelligence, AI, and machine learning may improve the accuracy of MS-DRG assignments and streamline revenue cycle management. These technologies can help identify patterns in clinical documentation and coding, reducing errors and improving efficiency. 4. Expansion of value-based payment models. As value-based care models continue to expand, MS-DRGs will likely be integrated into broader payment systems that reward hospitals for both cost efficiency and quality. Future updates to MS-DRGs may include more value-based adjustments to promote better care outcomes.
Conclusion. In conclusion, Medicare Severity diagnosis-related groups, MS-DRGs, are a key component of hospital reimbursement under the inpatient prospective payment system. By grouping patients based on diagnosis and severity, MS-DRGs ensure that hospitals are fairly compensated for the care they provide while promoting cost efficiency and quality improvement.